Should I know that I haven't asked about already?
I think one thing you should know is that we would never do this surgery if we didn't think it was going to benefit you greatly in the long term. In other words, the benefit of this surgery has to far outweigh the potential risk of the surgery for us to even consider doing it.
It's important to know that you're going to be worried about this surgery. This isn't going to feel okay. This isn't what you want to do. And it's okay to say that out loud. The best healing relationship between you and the people who provide care to you will be developed if they understand you, if they know what's on your mind, what you're worried about, what your questions are. Then they can give you information. And information is the best tool you have to get through what's ahead.
Probably, I get a question from a lot of patients about the ride home after surgery. We're here in St. Paul, but we receive patients from all over the state and from out of state as well. Some of them have long car rides. So I tell my patients that when they're driving home, try to, if you live far, try to take a couple of breaks, about an hour and a half, because the initial ride back home can be tough in a lot of the patients and the patients' families as well.
So one question that many patients have after they have surgery is whether or not I'm going to set off the airport metal detector. Okay, and that's because you have a fair amount of metal in the back after an operation like this. Somebody has studied that. We know that about 1 in 4 individuals who have scoliosis surgery, these implants will set it off. In the past, we used to give little notes or cards for TSA. Unfortunately, these days that doesn't go really far. If you're the 1 in 4, or part of the 25% that sets off the metal detector, typically, and that involves a pat down or some other security check, and that's similar to other individuals who have other forms of orthopedic implants that may set it off too. Another question that's commonly asked is, do the metal screws and rods stay in for life? And that's a great question. The important thing to realize is that the metal screws and rods are essentially holding the bones in your back in a straight and stable position so that they can heal together. Once those bones heal together or fuse together, the metal screws and rods aren't really doing anything. So at that point, it would be safe to have them out, but in the vast majority of the cases, the screws and rods that are buried deep inside your back aren't causing any problems. So we don't usually like to have kids go through another surgery, go through another operation, just take them out if it's not bothering them.
So a common question people will ask is, will I be able to get pregnant or have a baby after I have a spine fusion? And the answer to that question is yes, of course you'll be able to. There are circumstances where that might be made difficult. For instance, if we have to perform a fusion all the way down to the pelvis. However, what I will tell you is that it's incredibly rare that in patients with idiopathic scoliosis, we need to fuse all the way down to the pelvis. So getting pregnant or having a baby shouldn't be a problem for you in the long term. Another thing I guess you haven't asked is, what is the entire experience surrounding surgery like for me and my family emotionally? And what I would say is that it's normal for there to be 3 particular periods of anxiety surrounding surgery. One tends to be the morning of surgery, and people tend to have anxiety at that time because as much as you're watching this video right now, you're still a ways off from your surgery. However, the morning of surgery, this all becomes very real, and it's normal to be a little bit nervous or even emotional at that time, and that's okay. That's to be expected. Another time there tends to be some anxiety is the first time you're going to get up and sit at the edge of your bed and stand up. And the reason for that is that usually by that point you've been laying in bed for about 24 hours, you've gotten pretty comfortable, and suddenly we're going to ask you to get up, and you don't really know what that's going to be like as an experience. It's also going to be your parents' reflexive behavior to try to do what they can to protect you because you're their child and they love you. However, I would never, nor would my partners ever ask you to do something that you can't do. And sometimes it takes a little bit of a psychological leap of faith to know that you can climb that mountain and get over it. The third time there tends to be a little bit of anxiety is when it's time to go home. And usually the reason for that is that you've been having a lot of people participate and assist in your cares. And when you get home, the show is largely going to be yours and your parents, and that sometimes can be anxiety provoking. But just know that we would never send you home unless we knew that you were ready to go home. And know that even after you go home, we are always there and available for you if you need us.
You're not alone. You may not have a sense of comfort about where this is going to go, but you've chosen a good set of people to help you on this journey. People who have done this, experienced this many times before, from the doctors that you do know to the nurses you will know, that you will meet, who may be your friend or maybe someone who you just realized they were pushing you to make sure you got better. But you will be in the care of a lot of people who do know what they're doing, have done this a lot, and are there to take the very best care of you.
You should just be reassured that this is a great place with great experience and great people taking care of you. Reassured that everyone is going to work with you and your parents to get you through this comfortably and to ease your mind through it. This is a scary process, and it's natural to be nervous. It's natural to be anxious. And sometimes you look at your parents and they're anxious and nervous too, and that's totally natural too. So don't be worried about that. We'll get you through it.